Good afternoon. Myself, Varun Kumar, faculty of SNS College of Physiotherapy. Today we will discuss about the topic communication problem. Let's go into today's class. So introduction. Communication is essential for expressing the needs, emotions, and then the social interaction. And disability or disease may cause speech, language, or hearing impairments. So rehabilitation aims to restore, compensate, or adapt communication methods. So communication is communicating with one another in for their various needs or emotions, expressing the emotions or interaction with the peoples. So this is the expressing the needs or emotions and then the social interaction. So disability or disease in communication which involves speech, language, or hearing impairment. So patient with speech, language, or hearing impairment will comes under the communication impairment topic. So rehabilitation aims to restore their problem and compensate their problem or adapt the communication methods. Okay, so types of communication problems. So aphasia. So aphasia is the acute language disorder due to the brain damage or any pathology, brain related pathology. For example, stroke. So types of aphasia. So Broca's aphasia, Wernicke's aphasia, global aphasia. So Broca's aphasia, which will be involving of expressive, Wernicke's aphasia, which involved in the receptive. So in Broca's aphasia, there will be a difficulty in producing the speech comprehension relatively preserved. In Wernicke's aphasia, there will be a fluent but meaningful speech, and also there will be a poor comprehension. In global, there will be a severe impairment in both expression and then the comprehension. So rehab should be focuses on speech therapy, use of gestures, writing, and then the communication boards. Dysarthria. So anything start with this, it means it will there will be a difficulty. So in dysarthria, it's the motor speech disorder due to weakness or paralysis of the muscles which is responsible for the speech. So causes, there will be any form of neurological cause, especially stroke, a traumatic brain injury, cerebral palsy, or Parkinson's disease. So features or the clinical features present in dysarthria will be slurred speech, poor articulation, and then the monotone voice. So rehab involves in the dysarthria oral motor exercises, breath control training, pacing speech, and any, if needed, any assistive devices. So dyspraxia or apraxia of speech. So which means there will be a impaired planning or programming of the speech movements in patients knows what to say but cannot coordinate the muscle movements. So patient know what now need to speak, but they can't able to coordinate the movements of the muscles which is responsible for that speech. So for this type of patient, the rehab includes repetitive practice, phonetic placement, then multisensory cueing. So voice disorders. So voice disorders are caused due to the laryngeal trauma, vocal cord paralysis, or post-surgery. So features involves hoarseness, weak voice, then breathy speech. So rehab focuses on voice therapy, breathing exercises, ENT referral if needed. So hearing impairment, so it can be congenital or acute. So it leads to the delayed language development and communication difficulties. So rehab involves hearing aids, cochlear implants, auditory training, lip reading, sign languages. So cognitive communication disorders is also one of the communication problems which occurs due to the TBA or traumatic brain injury or dementia. It includes the features of poor attention, poor memory, poor problem solving, poor communication deficits. So rehab, which involves in these disorders, cognitive retraining, structured communication strategies. So principles of management. So in these conditions, the principles of management are focused on early identification of the disorder, and we have to focus on the interventions. So for that, multidisciplinary team approach is needed. So why multidisciplinary team approach needed? Because they have various pathologies. So for that, they need speech therapist, audiologist, physiotherapist, occupational therapist, and also psychologist. So in that intervention, use of augmentative and alternative communication, so which includes picture boards, communication charts, electronic devices, apps, and also family and caregiver training, and encourage patients' participation and reduce frustrations. So role of physiotherapist in communication disorders. So to ensure optimal posture and breathing pattern for speech, to facilitate the oromotor control through various exercises, and supports the speech therapist in respiratory and facial muscle training, and use clear, simple verbal commands during the physiotherapy sessions, and to encourage social interaction during the group therapy. So, for a case example, patient with 62 years old male having post-left MCS stroke with Broca's aphasia. So, for him, intervention includes speech therapist works on word finding exercises, physiotherapist encourages use of gestures during the therapy, and caregivers trained to use yes or no questions and communication broad. So, for communication disorder, mainly patient needs of physiotherapist and then the speech therapist. So, physiotherapist and speech therapist play a major role in the rehabilitation of the communication disorders patients. Okay, thank you.